Have you ever wondered why some patients suddenly lose control of their bladder even before reaching the washroom? Urinary incontinence is not just a simple leak. It's a condition that can completely shake a person's confidence and daily life. In simple words, urinary incontinence is the involuntary leakage of urine, meaning the person urinates when they don't want to. It can happen due to weak bladder muscles, nerve problems, or certain medical conditions. Though more common in women and older adults, it can affect anyone, regardless of age or gender. Today, we'll break down everything from its symptoms and causes to how nurses play a vital role in managing this often embarrassing yet treatable condition. So stay with me till the end because what you'll learn today might change how you care for your next patient. Now let's talk about what urinary incontinence looks like in real life. The main sign is uncontrolled leakage of urine, but the type of incontinence gives more clues. In stress incontinence, a patient leaks urine when coughing, sneezing, or laughing. This happens because the pelvic floor muscles can't handle pressure. In urge incontinence, the bladder suddenly contracts, causing a powerful urge to urinate, even when it's not full. This is often linked to overactive bladder or nerve dysfunction. In overflow incontinence, the bladder doesn't empty completely, leading to constant dribbling, commonly seen in men with enlarged prostate or diabetics. And functional incontinence occurs when physical or mental barriers, like immobility or dementia, prevent timely bathroom access. Understanding these patterns helps nurses identify the why behind the what, turning symptoms into actionable clues for better care. Let's go deep into what actually happens inside the body. Normally, urination is a finely tuned process. The brain, spinal cord, bladder muscles, and urethral sphincter all work in harmony. The detrusor muscle of the bladder stores urine and only contracts when the brain gives the signal. But in urinary incontinence, this coordination breaks. In stress incontinence, weakened pelvic floor muscles or damaged sphincter fail to resist pressure, causing leaks. In urge incontinence, overactive detrusor contractions send premature signals to void. In overflow, the bladder overfills due to obstruction or nerve failure, forcing urine to escape involuntarily. Sometimes, neurological disorders like spinal cord injury, diabetes, or stroke disrupt the control pathways between bladder and brain. The result? Loss of voluntary control, and that's where our clinical judgment and nursing observation become life-changing. Now, how do we manage it medically? The first line of treatment usually focuses on lifestyle and behavioral therapies, bladder training, scheduled voiding, and pelvic floor muscle exercises, also known as Kegel exercises. Medications like anticholinergics, oxybutynin, tolterodine help calm overactive bladder muscles, while alpha blockers such as tamsulosin relax the bladder neck in men with enlarged prostate. For postmenopausal women, topical estrogen therapy can improve urethral tissue strength. In more severe cases, botulinum toxin injections, pessary devices, or surgical interventions like sling procedures and artificial sphincters are recommended. The goal is simple: restore control, confidence, and comfort. But remember, medications and surgery alone can't do it all. Nursing care is the true backbone of patient recovery. Now, let's talk about the real heroes, the nurses. Nursing management begins with comprehensive assessment, evaluating the type of incontinence, triggers, fluid intake, and toileting habits. Nurses teach bladder retraining techniques, guide pelvic floor strengthening exercises, and encourage scheduled toileting to restore bladder discipline. Skincare is equally critical. Keeping the perineal area clean and dry prevents infection and breakdown. We also provide emotional support because many patients suffer silently out of embarrassment. Documentation, patient education, and timely referrals make a huge difference. As nurses, our empathy and evidence-based care can turn a patient's humiliation into healing. So next time you encounter a patient struggling with urinary leakage, remember, your care can help them regain not just bladder control, but their dignity.